Thank you very much for the nice introduction. So I'm an oncologist and radiotherapist by training, a PhD in lung cancer, nowadays running a healthcare consultancy business in Dubai. And so artificial intelligence, I'm sure everybody knows the term already. And for sure, this is basic knowledge that I guess all of you already have. But I just wanted to make sure that we're talking about the same terminology before I start my presentation. So artificial intelligence, everybody talks about AI, so I will talk about AI throughout the presentation. It is a computer algorithm which exhibits intelligence through decision making, trying to mimic the human intelligence. ML, machine learning, is an AI algorithm which allows system to learn from the data. And DL is a ML algorithm that uses deep, which means more than one layer, neural networks to analyze data and provide output accordingly. There are, of course, a lot of other things, a lot of terminologies related to artificial intelligence, but I mean, these are the ones that I will be covering in this presentation. So first of all, introduction. Artificial intelligence, as said, it refers to systems that do mimic the human intelligence to perform tasks. And the way I put it here, I intentionally didn't want to say anything like artificial intelligence will be replacing the human intelligence or will be superior to the human intelligence, because at the moment, at least, I don't believe that is the case. It is an aid, it is a tool. But the human intervention, the human control, the oversight is and will always be needed still. Artificial intelligence, as great as it is, it's a good slave, but not a good master, as they say about fire as well. So you need to master the fire also. So you need to master artificial intelligence. And if you have used like ChatGPT or any other OpenAI artificial, let's say, tools in whatever, let's say, even simple tasks, you might have noticed that artificial intelligence, unfortunately, it doesn't sometimes differentiate the relevant data from the unrelevant data. So it can also combine matters and things that are not to be combined or that are totally irrelevant. That is why in many cases, the human touch, the human control is still needed. In healthcare, AI has been utilized for quite a long time already. I recall having the first breast cancer predictive tool helping in assessing the outcome of the patients based on parameters that were put to the system. I'm intentionally not saying any brand names here or any tool names, just telling about the process. And that was discovered like 15, 20 years ago. It was also, and it still is, a good tool, but it doesn't replace the oncologist's opinion of the patient and the future directions for the patients. In oncology, as it is a very complex field with a lot of new drug discoveries, quite complex treatment planning, and a lot of comorbidities, especially with the elderly patients, and also a lot of different let's say, different points that need to be taken into account in the patient management and care. I think AI can be a very beneficial and useful tool to support the clinician in whatever decision making or even diagnosis and predicting the outcome. So in oncology, artificial intelligence role includes not only the early detection, if we talk about like mammogram screening or HPV virus screening, cervical cancer screening, or even PSA screening, colorectal cancer screening. These all artificial intelligence can be a tool to support and also to maybe just make the initial diagnosis that then will be confirmed by the human, by the clinician. It also aids to help to personalize the treatments based on the vast, let's say, trajectory or the information that has been uploaded to the data bank. So artificial intelligence can also spot some similarities, some trajectories that are more challenging for the human brain to notify or to notice. And hopefully it will enhance the efficiency of care. Still, what I'm also emphasizing at the end of the presentation is that artificial intelligence will never replace the human. And especially when we're talking about devastating, life-threatening disease like oncology, always the human needs to be there, the human touch, the comprehension, the listening, whatever the social skills are needed. Those of you who are physicians know that a physician is not only somebody who prescribes drugs or treatments. A physician, especially an oncologist, can also be the psychotherapist, social worker, even the priest, relative, or trying to replace the relative in a situation where there are no relatives and so on. So human interaction, human touch is still the key in treating cancer patients. I do have the references in most of my slides, and then I have the reference slide at the end of the presentation, and there are a couple of references I would wish you to read if you want to know more, if you want to familiarize yourself with the topic. So if we think about different applications that are already currently used of artificial intelligence in oncology. So what is already in place in several countries, not in all, and it's still, of course, very much in let's say, scrutinized and in test phase, is the support in the diagnostic imaging, meaning the detection of the cancer or assessing the outcome of the treatment. So AI helps in the interpretation of any CT, so CAT scan, MRI, or PET scans. Also, of course, laboratory results if needed. And it has been shown that the potential of artificial intelligence to notify, to notice, like initial, let's say, variations in the breast cancer tissue, it is as correct, as precise as radiologists view. Of course, I mean, this is very helpful, especially at the initial screening phase. What AI can be used and is already used in the treatment planning. So oncology as such involves very heavy treatments, toxic treatments, as well with a lot of adverse effects. And of course, we try to prevent the adverse events with the patient as much as we can. So AI can personalize treatment approaches using the ML, the machine learning models, to tailor the treatment according to the genomic data or whatever omics data, as they say, that is obtainable from the patient, and comparing it to the large database that has been put into the system, and they can predict the outcome or the potential outcomes. They can give probabilities of the cure or different treatment modalities and what should be addressed with this patient. Another topic is totally drug discovery. I do have another slide on that topic later in my presentation, but drug discovery has absolutely been revolutionized by the addition of AI. And predictive analysis, they are important. When we, let's say implement, when we have all the input to the AI system of the patient, the current situation, all the whatever omics data, biomarkers, laboratory values, of course, the physical appearance. Predictive analysis can be very useful to predict the next steps, to predict the outcome, and even survival rates. Still, I need to emphasize that it is still a machine, it's still learning. Nothing is, I would say, like made in stone. Nothing can be guaranteed, but it is a tool to help the physician. So if we start about the diagnosis of cancer, so AI systems like the convolutional neural networks, they do enhance the accuracy of image-based diagnostics. And as I said, the mammography, AI in mammography results evaluation, it does improve the detection of early stage breast cancer. This was a study done in the United States, and actually it equals to the analysis made by very experienced radiologists. It might even be superior to their analysis. And there's one case study on Google's DeepMind AI that really achieved the expert level accuracy in breast cancer detection. And then very interesting chapter is also the personalized medicine, because there is a lot of individually tailored medicines in oncology and also hematology. So I'm sort of combining oncology and hematology. Much of the treatments are same. Most of them are lethal diseases that need rapid interaction from the physician. So AI can support in the genomic analysis and can support selecting the right or the most suitable targeted treatment, like HER2 positive breast cancers or whatever. And of course, AI can also suggest different treatment options based on evidence and medical literature. And in general, precision oncology, sort of tailor-made treatments based on all the genomics, biomarker, and all the data that we have from that patient, it does improve the survival rates as it tailors the treatment. It can also predict potential side effects, and it can also aid how to treat the potential side effects. Radiotherapy is very integral part of oncological treatments. In most countries, radiotherapy is a separate subspecialty or specialty than oncology. Personally, I was trained as an oncologist and radiotherapist, so I have the both specialist degrees. And it is very important in radiotherapy not to harm the healthy tissues and to limit the dose, for example, the dose to the bone marrow, to lungs, to heart, to all the essential organs. And really, AI can help in the tumor contouring when designing the treatment field and also identifying the organs at risk and calculating the limiting doses, what can be given to the patient. And of course, this does save the hours, the workload from the clinician. And also, most importantly, it gives lesser side effects to the patient as the treatment area is limited, the dose is calculated correct, and so on. So AI in drug development. This is also very interesting. To my knowledge, most of the big pharma, and why not even middle-sized and small pharmaceutical companies, they have already integrated artificial intelligence into their R&D portfolio and practices. So artificial intelligence can actually even, discover new molecules, new drugs. There is one example, DSP-1181, that was totally developed by artificial intelligence. Actually, it entered psychiatry studies first for the obsessive compulsive disorder, and later on, it was recognized as a cancer treatment. This can significantly reduce the research and development time of the drug. In traditional pharmaceutical industry, the reduced timelines from 5, even up to 10 years to 1 to 3 years can be really a, let's say, major, let's say, new advantage for the company and most importantly for the patients. So in this particular case, DSP-1181, we are still waiting for the regulatory approval. It has entered the first human studies in the United States, but there are no regulatory hurdles at the moment that can be foreseen, even though this is like AI-developed molecule. And then I do also have a later slide on the regulatory implications of everything that artificial intelligence is inventing nowadays. In the predictive analysis, I already touched this, but predictive models can identify high-risk patients based on patient history, demographic data, and so on, the geographical area, and it can also forecast the treatment outcomes. Once again, a good tool, not the best master. It also can aid in predicting cancer recurrence and progression. For example, there are already existing predictive tools to assess chemotherapy response in triple-negative breast cancer, which is a very difficult to treat tumor type. And what about patient monitoring and support? I think most of us are already wearing some kind of wearable devices. I mean, like myself, having Apple Watch, I think most of us already have it, that do analyze the heart rate variability, in the body temperature, of course, how many steps you take, the physical activity, the sleep, and so on. And AI analyzes data from all these wearable devices also for real-time patient monitoring and also to detect early signals of complications and improving the patient outcomes. I just recently read in news that the Aura, the ring that you wear, actually saved one lady from her cancer to be spread because the ring showed that the patient had been deprived in sleep, and there was also some other, let's say, abnormalities in her, let's say, report, and she went to the doctor, and a cancer was detected. So this is also a very good aid for the patients for the early detection. There are a lot of virtual chatbots, and many of the companies, not only in healthcare, but also in other industries, are also already using these. The chatbots can provide patients with instructions, information, possible side effects, and also to help adhering to the treatment, which is important, especially when it comes to cancer treatments and overall treatments that you should take daily at home. For example, the Olivia Newton-John Cancer Research Institute, they already use artificial intelligence to create digital twins of tumors that can predict the response to the treatment and that can enhance the patient care. There is something that is also a bit concerning because AI does also address the healthcare disparities. That is, if we think about the topic globally. On the other hand, it can aid in this because AI can provide diagnostic and treatment recommendations in regions that are underserved, lacking basic healthcare facilities, lacking oncologists, lacking knowledge, lacking sometimes even diagnostic tools, and hopefully improving the access to the oncology care. So hopefully this will actually then aid in not so well-equipped regions or countries in the treatment, in the fight against cancer. It is also very important to note that AI can predict the adverse drug reactions, which are very often seen, unfortunately, which mostly, fortunately, are predictable and treatable. But AI models can predict the potential side effects. We talk about adverse drug reactions, and which leads to enhanced patient safety and, of course, increases the compliance to the treatment. And the precision oncology, that's something that has been developing very fast during the past 10, 20 years. Artificial intelligence has the potential to combine the genomic, the proteomic, we talk about omics data, all the clinical data, the history of the patients, the history of thousands of other patients, and can maybe identify patterns that are more difficult for the human to identify. And it also optimizes the biomarker development and the patient treatment strategies. And then also important is that I think many of you have already encountered it, maybe yourselves. If you log into a hospital website, healthcare website, there is a AI chatbot that will first try to evaluate whether your condition is critical, serious, urgent, or not so urgent. It can provide information, guidance, simple guidelines to the patients. And of course, it enhances engagement, saves the resources, the human resources, the financial resources of that unit also. Still, there are many challenges of artificial intelligence, not only in oncology, but also in other areas. First, I would like to raise the ethical concerns. There could be bias in the data sets that are given to artificial intelligence, and they can unfortunately sometimes lead to inaccurate predictions. Data privacy. This cannot be emphasized too much. We have seen too many data leaks, high-level data leaks, despite all the precautions, all the right, let's say, IT security measurements taking place. So, and what is very worrying if this kind of sensitive data would go into the wrong hands, wrong people. And especially in some countries, the regulatory issues or the regulatory hurdles can be a hindering factor or slowing factor in implementation of artificial intelligence to the routine use or not even so routine use. There is still a lot to be modified in the governance of several countries, several hospitals. And of course, we need to remember the patient privacy, the GDPR regulations here in Europe, and so on. The future directions. There are so many future possibilities with artificial intelligence that I really didn't want to list them all, and more to come as we advance, as the systems are developed and humans get more, let's say, familiar with, using chatbots or whatever. And integration of AI with these wearable devices, I already mentioned, it does help the patient. It is to monitor, but it is to monitor for good. It can be a diabetic patient, it can be heart condition. I mean, there are devices, even like my Apple Watch, that would detect if I would get atrial fibrillation or other serious, of course, cardiac arrest. Should that happen, it automatically calls the 911 or whatever the emergency number in each country is. Also, AI-guided immunotherapy. It can enhance the immune system responses against tumors. And as said, what is important is really to try to bridge the disparities, the inequalities in global care, not only cancer care, but also other healthcare system through scalable artificial intelligence solutions. So as a conclusion, AI is transforming and has already transformed oncology by enhancing diagnosis, personalizing treatments, and improving patient outcomes, leading to longer survival, better quality of life. Collaboration is the key between the healthcare professionals, between data scientists, and also the policymakers to realize the full potential and to harness it in the right way. It also empowers the clinicians to focus on what matters the most, which is the compassionate care for patients, the human touch, the human intervention, the one-to-one interaction that is always needed between a physician and a patient. So here are some of the references. The last two ones are very simply written: Artificial Intelligence and Cancer by National Cancer Institute in the United States and the cancer research that could be worth reading. And there is a lot of data in Google, if you Google it, and a lot of courses, several universities organize AI courses, especially for healthcare professionals. So I would encourage you to learn more on this topic, to be abreast of the development that is inevitable, that is already there, in order for us to be the masters and to have AI helping us, not mastering us. So with these words, I would like to thank you for your attention